Oh,
Okay, can you hear me okay?
can hear you perfect.
Great. And just to confirm, can you see the tab with your name on the left-hand side? We're
I
selecting
can,
now?
yes.
Great,
Yes.
that's where your presentation is going to be.
Okay, let me just, this thing is trying to connect to some,
No, you can close one of them.
okay, there we go. Okay, I think I'm good. So say again, so where do I go?
So on the left-hand side, you should be able to see a tab that has your name on it.
The left or the right?
On the left, where the panel is, where the presentation currently is.
Okay.
So
I see. Right there at the top.
there.
Okay. Perfect.
Great.
Great. Okay.
So
Okay.
I'll be talking first and then passing the floor to Thorpe and Denton, and then we'll be passing it to you. Is it?
Sure.
Great.
Thank you very much. I'll be
Thank you.
reading now.
Thank you.
Thank you.
Hey,
Hello,
hi
sir.
Thorpe.
Hi, me?
I can hear you a little bit far. Can you try again?
Oh, I hear you very well.
Oh, I
Sorry,
hear
just say
you
again.
very well. Can hear you very well. It's like a distant.
Okay. I don't really know.
You get closer to the microphone?
I am pretty close to the microphone. If I speak louder, can you hear me now?
Yeah, better. Look, can you hear him fine?
Yeah, I hear him.
Great.
I can also hear from my side.
Perfect.
Ali, remember
So-
we've got me and Denton is here.
Yeah,
So
Denton.
Denton will be presenting right off.
On the left-hand side of the screen,
Hello, Denton.
yeah, on the side of the screen, you should be able to see two tabs. One with your name, Thorpe, which I'm selecting now, and with your name, Denton, which I'm showing right now. So when it's your chance to speak, you just need to select the tab with your name,
Yep.
and then you'll be able to move the slides.
No problem.
Great. So we're all here. We're just going to wait 5 or 6 minutes till the hour, since it's early and we're waiting for other attendees to join. And to the attendees that joined us today, the session is being recorded, and you have been muted upon entry. So if you have questions during the webinar, feel free to ask them via the chat box.
You'll have to speak up. I don't know if the connection is not great. So,
I remember last time we lost it all.
so there's your...
Yeah, Thorpe, if you can, in the meantime, mute your microphone, that would be great.
Okay, and can you just confirm that you can hear us properly?
And both Lukman and Andre can hear you fine, and maybe where attendees can confirm that you can hear fine, you can do so via the chat box. If you can hear, can you just say yes?
Okay, mute now.
Thank you. Good morning, and thank you for joining us today in our GGHH webinar, Sustainable Energy Efficiency Practices in South African Hospitals. We will be starting in 2 or 3 minutes as we see people from different countries joining us today. We also want to use the opportunity to welcome all the participants in the Western Cape GGHH Forum. We know we have like 20 attendees listening us right now from South Africa, from everybody. Thank you for joining us today again. My name is Alejandra Lifshitz. I'm the Communications Coordinator for Global Projects at Healthcare Without Harm and Global Green and Healthy Hospitals. We'd like to welcome you to our webinar series on sustainable energy efficiency practices with case studies and examples from South African GGHH members. We have 3 speakers joining us today, and we see people from different countries joining us also. Shown in the attendees list, but we are aware that are participating in the webinar are the participants of the Western GGHH Forum in South Africa. We have other 20 attendees joining us from South Africa right now. The session is being recorded and will be posted and shared through GGHH Connect, our social media platform for GGHH members. And if you have questions during the webinar, you can ask them via the chat box, as you have been all muted upon entry. With an introduction on global green and healthy hospitals, and then I'll pass the floor to Thorpe and Denton, joining us from the Western Cape Forum. So a little overview and introduction on GGHH. Global Green and Healthy Hospitals is an international network of hospitals, healthcare facilities, health systems, organizations from all around the world, which members that are working to reducing the environmental footprint and promoting public and environmental health. Global Green has the foundation on the GGHH agenda, which covers 10 different interconnected sustainability goals for the sector to address and promote sustainability and environmental health. Members in different parts of the world are working in either of these 10 different goal areas. GGHH 110 members from 48 countries, representing the interest of over 25,000 hospitals and health centers. And you can see the different which we have members and the different representation of members all across Africa. GGHH programs benefits for members are information on the 10 sustainability goals and also participate in the 2020 Healthcare Climate Challenge, which intends to protect public health from climate change, about to guidance documents for sustainability and healthcare action, and education sessions like the webinar that you're participating in right now, and 2 great online platforms, GGHH Connect, a social media platform that allows members to collaborate and interact on sustainability issues, ask questions, connect with experts, and share your successes. And U Hippocrates Data Center that allows our members to measure their carbon footprint and environmental footprint and track progress. We have guidance documents that provide not only information on each of the areas described in the GGHH agenda, but it also provides action items and case studies with strategies and tips on how to implement different environmental projects in your institutions. Webinars, all of the webinars have been recorded and are posted on GGHH Connect. The presentations from our speakers are shared through the GGHH Connect platform. Contact information from experts and panelists in case you'd like to ask a question or in touch with them. On the greenhouse side, we have a series of case studies from members from all around the world. Currently have over 120 case studies showing examples and processes of implementation challenges of different members that have encountered while implementing sustainability strategies in their institutions. Available in English and Spanish, some of them are available also in Chinese and Portuguese. If we have people joining us from other that don't necessarily speak English. As part of membership, members get not only access to platforms and benefits, but are also promoted and advertised as their participation in GGHH. Membership certificates, the chance to participate in awards with international recognition. We're using a series of testimonial videos, as the one that is shown here right now, and you get a chance to be featured in our newsletter that is sent out to over 5,000 contacts from all around the world. To GGHH Connect, which is an online social media platform for members that allows to connect with experts, GGHH members in multiple languages and in the different goal areas. So you not only have access to the different tools and resources, but you can post a question around a challenge that you might encounter while implementing a project, or get in touch with an expert, or find sources or information that might be useful. And as I also have access to the Hippocrates Data Center, the first international platform that allows the healthcare sector from around the world to measure actions toward reducing environmental footprint. And some familiar names on our attendee list and also our panelists have either used GGHH Connect or Hippocrates, and maybe can speak to that as well. But GGHH Connect and Hippocrates Data Center allows you to submit through the sustainability forms, and as you can see, very on the left-hand side, produce benchmarking and graphs reports that allows you to see where you are, comparing your progress against yourselves or against other members. So in GGHH and our network, it's very easy. You just need to visit our greenhospitals.net website. You can load a letter of intent to join, send it to the GGHH Secretariat, and we can get started with your membership process. And Denton, I'd like to pass the ball over to you. So Denton.
Yes. Can you?
The floor is yours.
My name is Denton Smith. I'm the head of engineering at Groote Hospital, which is a tertiary hospital in the Western Cape of South Africa. The presentation I'm going to be doing today is one which is of energy efficiency, reduction of carbon footprint by improving steam plant through correct maintenance. It is presented in a case study format, as we shall see. Right, this is a should be familiar with because this specific slide comes from the GGHH forum website. It shows that pollutant gases come from the northern hemisphere, effectively, or first countries. However, the people affected most throughout the world are the developing nations, the third world countries like Africa and India. If you look at Groote Scale Hospital, we look at leadership, waste, energy, water, transportation, and building. Now, these are aligned with the GGHH goals themselves. Groote Scale is a very large hospital. It has roughly 19 hectares of ground and numerous other smaller hospitals on site. Filled in red is the boiler house that supplies steam for heat sterilizing to the maternity block, as well for heating, cooking, sterilizing the main hospital itself. Hospital goals are to reduce energy costs, reduce CO2 emissions, improve structure, and reduce wastage. We've managed to progress and achievements are reflected in financial benefits, where we've reduced carbon since 2009 by roughly 48%, and we are producing far less in terms of soot, as well as smoke emissions, which is greatly benefiting the surrounding areas of the hospital. That if the human health benefits, because there is a reduction in broader respiratory ailments of the neighborhoods which are downwind of the hospital itself, and it's also reduced complaints from surrounding neighborhoods because of the changes that have been done in the boiler house to reduce fires, etc. Quantities, we wish to, as I mentioned before, reduce the hospital steam consumption through standard good quality maintenance regimes in lower water, electricity and costs, as well as consumption throughout the hospital, as well as unplanned shutdowns of the steam lines. The issue is, with old systems in need of overhaul. In some cases, they're born on 100 years old. This is what is steam reticulation, low condensate, return temperatures, requiring more quantities of coal to reheat the water, minimal return condensate, require extra use of municipal water into the to make loss and test running of boilers, as well as load on due to leaks in the reticulation. This is an example of pipe runs throughout the hospital. They are long and they are in some cases old. We are trying to improve the sustainability as far as possible by employing primarily first engineering principles, which basically, if you can maintain it better. So simplicity is the way to develop an easier way of doing maintenance. We're doing regular checks, we're developing checklists for checking of lines to identify faults and leaks. And to create a sense of ownership, we assign specific sections of the plots to teams within our mechanical engineering department. The plan, again, developing an approach to the project that was methodical, researching installation from design literature. Go back to the originals. The originals are generally the simplest, easiest form of maintenance and efficient energy consumption. An approach which can use in a methodical way, and choose simple engineering practices, so that users and staff are able to initiate and perform repairs themselves. I'm going to show a lot of pictures shortly, but we're relagging our boiler flues, relagging of the boilers, the steam lines, the condensate, reticulation. All we are trying to retain as much heat as humanly possible to save on coal. All boiler fittings as well as main steam lines, again, of leaks, reticulation leaks, removal of dead steam lines. A dead steam line can waste a huge amount of energy if it is kept hot but not doing anything at all. Replace steam traps as well as the replacement of condensate and hot well tanks. We do raising of the boiler tubes that allows much better transfer of heat. The replace generators as well as induced draft fans allowing much better transfer of heat and flow through the boilers, as well as scrubbing or removal of fallout, be it soot or fine particles from the chimney itself. Installation dryers allows us much better control over the burn as well as noise control and a complete upgrade of the electrical system in the boiler house. The replacement of the hot well tanks, and there's the new condensate tanks. Output separators, they were archaic to say the best, and are now cyclonic separators, which are efficient at removing as well as medium and large size particulate matter from the smoke. Relag lines, that's before, after. Relag the flue pipes, that's the chimneys, before, after. Up to the electrical side, it's illegal that installation is now very untidy. The boiler house went from this state to that, which is a marked improvement, and the themselves want to be around the boilers more often. The absenteeism of staff in the boiler house itself. The emissions went from that to this in 90% of the cases, unless you're doing soot blowing, which is one of those to do with boilers. The areas of consumed within the hospitals, the production of domestic hot water, space heating, cooking, and sterilizing. Hot water circulating pumps, we've replaced the hot water circulating pumps and put new ones in, which allow for better, faster circulation of hot water around the hospital. Again, less losses in the lines because the hot water is exposed to factors for less time. None of these pits, they are all as they are. That is the hot water plant room for the hospital itself. Challenges learned. Supplying people to fund the project. We had to learn how to do that. That was a major challenge, was dealing with supply chain at the best of times, especially a government-based. From that to savings and carry on. Getting the mindset of the staff to change. With mindset change comes. With change comes commitment. With commitment comes passion. With passion comes the drive to qualify higher. And from the project, not only have we reduction or we have reduced the consumption of coal, but also managed to qualify 7 mechanical artisans. The result of coal consumption shows a dramatic and continued downward trend, as well as the hospital water consumption is also showing a downward trend. We're also aiming at save as much water in the hospital as possible. Example of our coal consumption, how it's been reduced, and it's reducing. In 2016, we've managed to reduce our domestic water consumption in the hospital by 56%. And hospital will be supporting healthcare into the future. And thank you to the CEO of the hospital as well as the engineering team in the GGHH for the climate-related mortality map. Much. I'll do Thorpe.
Thank you, Denton, for your presentation. Thank you very much.
Okay. Good morning, everybody. Ali, can you just confirm that you can hear me?
Perfectly fine.
My name is Thorpe Koorts. I'm from the West Cape Department of Health, for the Infrastructure Department. And we're commissioning of infrastructure in the Western Cape. So we are ideally suited to implement techniques in reducing energy use. My personality, one of a resource conservative person, and my engineering is in background, so I've got a passion on saving energy. And today with you, something to try. I would have said something new, but it's not. It's something very old. I want to share our experiences in trying, and it's something that really works well. So we're anything from a forum in the Western Cape inside a building which is called Valkenburg Hospital, which is an old pediatric building that was built in the late 1800s. It was built by a Scottish architect and built from 1893 onwards. So this shows the building. The building was originally designed very interesting to get a pleasant environment inside the building. So it's interesting, in the days before electricity usage and split units and centralized air conditioning, there's a problem. They had to create a pleasant environment inside buildings for the occupants and for staff. So if you close the building, you'll see that there's these funny protrusions coming out of the roof. All sorts of chimneys and stuff. Just to give you an idea of one of these chimneys, it's called a boil ventilator. And if you look at it closely, you'll see that it's got these fins inside, which simulates an airfoil similar to an airplane wing. So that there's a breeze blowing across it, it creates a low pressure area inside the ventilator, similar to an airplane wing. As I said, this was designed by a gentleman called Mr. Robert. That is one of the earliest plans I could find of his invention. You can see he had a few inventions there. I see him and his son were selling these across England. And I've seen evidence about them being installed in Parliament and churches and schools and so forth. What you're looking at is the very early air conditioning split units, minus the electricity. They did not use any electricity. Okay, so how did let's have a look. So that's split section through the building. There's split section through. So you'll see the building. You've got nice high roofs. Now you've always got a breeze on a very nice hot day, and the breeze creates a low pressure area inside the ventilator, which is connected a system of ducts, rooms through louvers and grilles. So once it creates a low pressure area inside the ventilator, it starts drawing air through the ductwork system. It's a system and it works naturally. So window, or you've got louvers inside the walls everywhere, then you get a fresh draft coming through the through the room. It works in tandem with quite a few things. So you'll see there's nice thick walls, the way that they used to build buildings back in the day before there were wall cavities. There's a veranda. So being in the southern hemisphere, our sun comes from the north, so your verandas would be north facing. And so all of these features complement the system. So you've got a nice fresh draft coming in from a shaded area, maybe underneath of a veranda, somewhere with green vegetation. So you get some nice moist air coming into the building, and it creates a cooling in the building as well as a nice draft. Just to see how this works through the different seasons. So we've got summer. Your veranda would cast a shade where you're drawing the air in. And in the winter, the veranda would, you'd still have some irradiation coming in through the window because the sun is low. And simply close your louvers and your window. It won't participate in the draft effect so that you can gain solar gain in the building. So it basically works. So what we've recreated this across the entire hospital, and we reinstate this practice, this design, rather than put in any centralized air conditioning or put in any split building. And does it work? Well, yes, absolutely works. It worked 120 years ago, and it will still work today. So the result is you're getting nice cool effect in the summer. If I'm saying cooling, you know, 18 degrees Celsius air conditioning room. But on a very hot summer day in December in South Africa, you'll have a very pleasant environment in the building, and patients can experience a nice environment. We don't get complaints from staff. It also aligns with our TB policy building. It, of course, doesn't use any electricity, so your usage carbon footprint is zero. And there's really no maintenance on the system, except we can imagine maybe some dust collecting on the louvers or the grids. There's a drawback with the system. Design originally was designed to work in tandem with fireplaces, but being a hospital, we've decided not to allow fires in the. So our back on the system is in the way you have no added benefit over a normal building, and we've also put in heating. So we employed a different technique. It's called change management. So we've put forward a few ideas of how to keep yourself warm in the winter. Fortunately, we in South Africa, so our winters isn't extreme. It doesn't get below zero, but a fresh early winter morning is still cool. And we persuaded people to dress warm to work. If patient is cold, is it really necessary to heat up the entire ward just for 1 or 2 patients that's cold? When you can rather give them a blanket. As we encourage people to take the stairs, dress warm. The lady that you see there is Sinead. She's our project assistant. She's a nice little blanket in her office. So when she sits down, she puts the blanket on her lap, and this works. So in combination with change management, these things. So what is the potential of this system? This is a fairly recent profile of our electricity usage for health buildings in the Western Cape. I'm sure that across the world you'll have very similar profile features. If you look on the left-hand side, a day clinic, it is staggering to think that you're providing a health service and almost 3/4 of your electricity usage goes into tempering the air and ventilating the air, which is because of TB policies and so forth. Now, this 4% I've got there is combined heating, cooling, and ventilation. And on the right, you've got a 24-hour hospital, so the portion of air conditioning and ventilation is not that high because you've got other things like patient hot water and preparation of food and things like that. But it's still a lot. So these are massive areas of improvement. So if we bring this design into more buildings and explore how to operate designs such as this into new buildings, there's massive savings to be had. And if you all experience the nice climate we find in our buildings, you're welcome to come and visit us. And I'm listening. Elliot's back to you.
Denton, for your presentations, and thank you for our attendees and the participants joining us from the live forum in South Africa. I'm going to pass the ball to you. So can you confirm you can now privileges to present?
Great. Thanks.
Great.
Everyone,
Thank you.
can you hear me, Ali?
Yeah, I can hear you perfect. Thank you.
Thank you very much. Okay. Thank you everyone for joining. I'm Nortje. I'm an energy engineer and I'm responsible for energy management of all our facilities across South Africa, as well as some facilities in the UK as well. But I'll share some more information around the Netcare Private Hospital Group as we go on. Great. So it's just an overview. We are the company's only shares have been listed on the Johannesburg Stock Exchange in South Africa since 1996, and we only had 4 hospitals, and currently we have around 116, of which, like I said, 60 is around in South Africa, and 40 is more or less 40 is BMI in the UK. There's some interesting numbers. We've got around 13,218 registered beds, 90 primary care facilities, which is typically your Medicross facilities in South Africa. Obviously on our website if you would like more information. Great. Just problem analysis, which we identified into 2013. So obviously there was a huge increase in energy costs, emerged national energy crisis with Eskom not being able to supply everyone with energy they need. The increase on the limited natural resources. Obviously, South Africa is a large coal energy user, and there's obviously a limited resource. And then obviously global warming. In 2013, Netcare's energy footprint about 232 gigawatt hours per annum, and we focused that those numbers that went over to around 360 million in 2018, which obviously is ever increasing, and we thought, okay, right, let's reduce that as fast as possible. Great. First is to know, well, to measure to know, and if you need to reduce your energy cost, you need to know where to reduce it first. This slide is more or less the same as what Thorpe did, although I would like to just note that this is for private hospitals, as Netcare is a private hospital group. GGHH goals is reducing, well, the reason Netcare joined GGHH was for reducing operating costs, to responsible corporate citizenship, and provide safe and quality healthcare. Our aims were energy, water, waste, leadership, of which this session covers energy. Just a small indication here, as you can show, energy, or our system breakdown is like this. We've got about 48% on HVAC, and then water and other medical equipment as your radiology equipment and so forth. So having identified where we spent most of our energy, we went and we looked at different solutions as to how can we obviously identify. So the first we have, I see the slide is a bit dark there, is HVAC control. How can we control our systems differently, using more fresh air inside the system, and when it's cooler, and the different means of just having your overall system running more efficient. Treatment systems, getting your coils cleaned every once in a while, more ventilation, more heat transfer, occupancy sensors inside the room for people leaving their offices on throughout the day, smart trailers, all different water heating. There's a whole bunch of water heating technologies out there. Heat pumps, most probably the obvious one, but also there's a whole bunch of water heating, that free heating that you get from your solar systems, your air conditioning systems, which you need to try and use. And so water is also a very large contributor in that. Lighting, in the previous slide you saw lighting is significant, and then all numbers that we had. We set ourselves a target of 30% energy reduction by 2018, and the 30%, as in the graph on the right hand side, just shows you how that would increase from 2013 to 2014, 2015, and if we take 10-year forecast, the graph on the right hand side is just the graph on the left hand side translated into 10 years, and that equates to around a saving of over 1 billion rand of rand. The question now comes in, where we see our savings. So when we looked at implementing all these projects, we still see the energy consumption on a year-to-year basis increasing. So here we can see 2013 is increasing to 2014, still increasing to 2015. So the question all your investors starts asking is, why is there energy savings? Why is my energy cost still going up? And then there's obviously a number of considerations you need to take into account, such as rising energy costs. You'll see the graph is just rated in the currency. The hospital is experiencing possible temperature impact. Any slight changes on your temperature has quite a significant effect on your HVAC system. And then there's a whole bunch of other things that also need to be taken into consideration. So into consideration, it's better to start looking at what is your energy intensity doing. Let's say kilowatt hour per day, or kilowatt per square meter, or whatever you want to use. And then look at, so when we look at 2013, the energy costs were only 92 cents. In 2016, that went up to about 117. That's into consideration a whole number of tariff switches Netcare went into. So the R1.17 might have actually been quite significantly higher. And then also looking at the growth, there was more than 7% growth that Netcare experienced. When looking at that and looking at the numbers in 2013, as we heard about 23 gigawatt hours for 2013, that went down to 21 gigawatt hours in 2016. And looking at your energy intensity, that went down from 96 to about 88, which is a 16.2% energy reduction across our entire board. So an easy way then just to show how you do what your savings actually. Then just show successes achieved in 2013. You'll see the program was implemented in 2013, that went up 2014, 15, 16. On the right hand side you can see typically we expect it to happen. So our energy intensity around 248, and that was expected if no changes were implemented to go up to 273, whereas it is around 247. So although the line seems relatively constant, you need to take your growth into consideration, and this area underneath the graph is obviously what your energy savings were for the total period. When you count area, that was around 69 million for the Netcare Group. So projects was a national lighting project. We replaced 115,000 lights. That equates to about 20 megawatt saving across our board. The solar project, currently we're sitting at around 10.4 megawatts, which would be finished installation at October 2017. Your hot water systems, replacing electric boilers and geysers with heat pumps, and systems versus chilled water systems, and looking at the different technologies and what they offer you in the areas. So there was a number of challenges. One of them being feasibility, just proving back any project that one needs to implement normally needs to prove payback. Good operation and maintenance practices, as Denton managed or mentioned, there's a whole bunch of savings that you can achieve by good operation and maintenance. And when you install a heat pump and you don't maintain it, it's just working as a boiler again, consuming a lot of energy. Creating awareness is a major challenge, which is most probably your most easy and most cost-effective solution. Availability with solar PV becomes an issue. As the PV becomes cheaper and cheaper, you can put more and more on. Space is definitely becoming an issue. And then obviously implementation without risk to the patient. You can't just shell an hospital to do a design into a system. Going forward, we need to start looking at fuel cells, I believe, solar systems on carports, grid interactive energy transfer, where you generate electricity on a different site using means as fuel cells, solar PV or whatever, and you transfer that through the grid, which in other countries are now possible at this stage, although South Africa. And then green design principles, having good and then obviously new generation medical equipment, which is more efficient. The picture is the fuel cell, where you have nitrogen going in, got oxygen coming in, heat and water going out, as well as electricity. So your byproducts are heat and water, which heat again you can use where you need to in your domestic water system, with out as well. And that's my presentation. That's just a couple of slides of some of our solar PV projects on the different. Thank you very much.
Thank you very much for the great presentations. We have 20 minutes for questions and answers. We have some questions coming in while presenters were doing their presentations. If you have others, feel free to use the chat box. I'll start with the questions. We have this question for Denton. The question says, why are you still using the coal boilers? Any plans to completely phase this out?
The answer is generally quite a simple one. Sorry for the throat. The reason we're still using coal boilers is that we end up with energy transfer. The best way to do heat energy transfer and the efficient way is by means of heat exchanger, normally shut using steam as a primary source of heat. Inside, it's relatively unique because we've got long distances between where we primarily generate electricity and Western Cape and Cape Town itself. These electrical losses between generator and we as use our electricity are really in the region of 40 to 50%. So if 1 megawatt of electrical heating a Groote hospital, 1 megawatt worth of steam heating, the generating it means again of coal-fired power stations, they're going to have to produce anything up to 2.4 megawatts of power to overcome the losses before it gets to us at the hospital, so we can use 1 megawatt's worth of power. That is it. And to heat up water, as I say, one of your most efficient ways of doing it is by heat transfer in a heat exchanger, which is heated by steam. However, doing the best we can to shun as much wastage as possible. I'm looking currently at a process where we use sewage to generate the biogas and in the biogas it's going to be used as opposed to coal. So sewage from the hospital, hoping within the next 18 months to 2 years to be able to be using the gas generated by that, to instead of using coal, to use that biogas as our main source of heat in the boilers.
Very good. Very much for that answer. Thorpe, I have you with the microphone open. There is a question for you, which says, if there are any plans to go off the grid, total dependence on solar?
At this stage, no. We our solar development is not that reliable yet. Initially, we would love to. So for now, we're just adding as much as we can. And we will be funding for it, but immediately now, I don't think we can go off the grid yet, unfortunately.
Denton, I think the question was for you as well. Sorry.
Love to go completely. No, no problem. We would love to, as a hospital, go completely off grid, be it electrical, heating, and or water consumption. But definitely, with the current required, complete go off the grid as far as solar is concerned at Groote Hospital, we do not have the space to do more than 0.5 megawatts worth of solar panel generation. It is also in the pipeline, so we'll be able to hopefully iron out some of our peak energy draws with that little bit of extra solar power. But at the moment, we are not able to go off grid, although that's something I would love to do.
We'd all love that.
I have various different things, which was mentioned earlier, lighting up my parking areas and such like by means of hydrogen fuel cells. These are all different renewable systems that we as a hospital are looking at to try and lessen our impact on our resources that we're heavily dependent on.
Thank you very much. Andrea, we have a question for you, which says, is the cost saving significant, especially as energy cost is also rising?
Repeat your question?
Yes, the question asks whether the cost savings are significant, especially as energy cost is also rising.
South Africa is definitely significant, and it's a matter of why, as a sustainability engineer, look at is return on investment. So for every rand I spend, I try and pay that rand back within a 5-year period. And looking where energy cost is going in South Africa, it's escalating by around more than whatever inflation rate is. Currently about 6% in South Africa, whereas energy rates are skyrocketing at around 16% in South Africa, and it's definitely a place for South Africans to start looking into future. I know South Africa still currently has a very low energy cost compared to the different other sectors or other countries, but it's definitely becoming feasible, and I definitely think looking at the COP21 goals and the 2050 goals, where we try and reduce our gases and energy temperature rises below 2 degrees, it's definitely something that we need to go look at green solutions and see where we can save energy on the green energy production, as well as energy efficiency, as that's your cheapest source of saving.
Thank you, Andrea. We have a question from Bhutan for any of our speakers or all of you can respond. And the question says, hospitals in Bhutan use electricity generated from hydropower. So what would be the alternative to go green further than this, in your experience?
So I can perhaps comment. I definitely think solar is a very cheap alternative to energy generation, although hydropower is also a very good alternative and something we in South Africa are not as blessed with to have. So taking into consideration that you are already using hydropower, using it, the only other alternatives would be to use natural gas or oil in that case, which is I won't recommend because it's not a green. So obviously natural gas and solar power is my ideal. I don't know how the wind and things is in your country.
Okay, Thorpe, Denton, would you like to add anything to that question?
Sorry, we hear Andre very well, so I'm not sure what he said, but I think if you've got hydro in your country, you're blessed. And hydro is a very, very great renewable to use. It's always nice to supplement it with wind and solar. But if you've got water, then hydro is a great way to go. Denton?
Thorpe is saying it's ideal to go hydro, but unfortunately, we don't have that luxury here in the Western Cape, in Cape Town area, or Africa in general. But the biogas option is definitely something that one can look at, where one uses biogas to produce steam to a turbine, which then runs a generator. So one could use, as mentioned, if one could use the waste coming out of a building, a hospital, a block of flats, such building, to produce sufficient gas to produce sufficient heat energy to actually generate electricity or part of the electrical consumption of those buildings. I think this is something which will come in time, but not quite yet, but hopefully in the next 10 years.
Very good. Last question before we wrap up, and this one is for you. The question asks, what instruments can be used to identify leaks?
Ali, what type of leaks are you talking about? Leaks in insulation system or water leaks?
So maybe you can address both or choose one.
Don't mind.
If I can come in here, I think it's
Oh.
It's with regards to steam leaks.
Okay, with regards to steam leaks and with regards to water leaks, they're all muchness in a way, but your main way of finding any leak on any system, if it's steam or water, is to literally walk the system. If it's dripping, if it's hissing, if vapor coming out of it, it's leaking and fixed. There are ways of doing it where you can't physically walk it and check it, and that's by shutting off or isolating sections of those pipelines and putting a pressure gauge on, pressurizing the area and seeing whether or not that pressure is held. If the pressure is held in a contained environment, then however, if the pressure drops, then there will be a leak. So that needs to be found thereafter. But that's it. It's a case of physically going out there and getting your hands dirty and finding the leak.
Okay, thanks. And with this last question, we're going to finish our session for today. I would like to thank our speakers joining us today, the attendees that have joined us throughout the session, and again, the participants of the Western Cape GGHH Forum in South Africa. And a big thank you to Lukman Yusufu from Groundwork, who has helped coordinate the webinar. If you join Global Green and Healthy Hospitals, it's a very easy process. We invite you to visit ggh-greenhospitals.net, and you can find all the information about membership, about benefits and resources, and about future training sessions. This session has been recorded, and we'll be sharing the presentations and the video of the webinar with you all via email. We appreciate you having stayed throughout the webinar, and we wish you all a good day.
Thank you, Ali. Bye-bye.
Bye.